Occupational therapy assistants are the bedrock of treatment provision in many OT departments throughout the country. In fact, OTA jobs account for about 25% of all available OT jobs in the United States. In large rural skilled nursing facilities, about 58% of OT staffing minutes are provided by OTAs. And in rural and underserved communities, about 48% of all Medicare outpatient therapy services are provided by OTAs. But not enough continuing education has been geared towards the unique challenges and opportunities within this profession. That's why I'm so thankful to begin a new annual series on hot topics for OTAs. Today we have our first guest, Amy Mahle, EDD, COTA, ROH. Amy and I will discuss the hot topics that are top of mind headed into 2026, from evolving reimbursement to the changing OTA job market. So let's dive in. Welcome to the OT Potential Podcast. Before we begin, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform. But to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. After listening, you can log into the club to take a 5-question quiz, and we will generate a certificate for your time today. Okay, here we go. Welcome to OT Potential. I am your host, Sarah Lyon, OTRL, and I am just so thankful today to be joined by our guest, Amy Mahle. Amy is a servant leader, educator, collaborator, and author who values and experiences joy by investing in people, uniting others, and inspiring them to take action towards meaningful projects and issues. Amy earned her Associate of Science as an occupational therapy assistant in 2007, her Master of Health Administration in 2012, and her EDD in Community College Leadership from North Carolina State. Amy is currently the founding program chair of the Occupational Therapy Assistant Program at Rowan-Cabarrus Community College in North Carolina. She has worked in higher education for 16 years, and prior roles include owning a small business and working clinically as an occupational therapy assistant. She has held various volunteer leadership roles at state and national levels, including recently wrapping up her term on the American OT Association Board. So without further ado, I will patch Amy into our live studio. Welcome, Amy. It's so great to have you here today.
Thank you, Sarah. I am so grateful to be here today with you.
I am so thankful for this conversation. Just one big picture, I feel so changed as a professional from my early partnership with an OTA. For me, as a new grad, having an OTA that I partnered closely with was just really life-changing. Like, it helped me understand what I was good at, how to work together with someone who had a different skill set. I'm such an absent-minded professor, big picture thinker, and the OTA I got to work with was so attention to detail and had the confidence to really challenge me and push me on things. And I'm forever grateful for that professional experience. And with that in mind, when I look at some of the topics that we're going to talk about, some of the trends that we're seeing in OTA, I do not like some of them. I feel fired up about them. I feel like we need to be talking about them and we need to be changing some of these trajectories. Before we get to those things, though, I just want to learn more about you and about your story. Yeah, can you tell me about just how you became an OTA and where that's taken you?
Sure. So my OTA journey, sadly, didn't even begin until I was in my mid-30s. I had never heard of occupational therapy before. I worked in social services. I was a business owner, and I got burned out owning a small business. I was there for 7 years, and I just needed something different. I could feel myself. That burnout was really unhealthy. And I'd always been drawn towards the medical field. I thought when I went to college, I would be a physician. And I thought, well, let me go see, what's available at the hospital for jobs. And I found the words occupational therapist. And I'm like, what is that? I've never heard of that. Of course, I Googled it and found that there were all about the profession. I'm like, oh my gosh, this sounds so much like me, like what I want to do, hands-on creativity, problem solver, working with clients, empathy, all the things that I valued. And I thought, well, I'm a mom, a wife. There were very few schools in my area. I already had a bachelor's in psychology, which was a wonderful foundation. But to go directly to become an OT, I would have had to drive 2 hours both ways, every day of the week to OT school, which was not nearby and not sustainable. And I also didn't have anatomy and physiology. And I thought, well, I can't go do occupational therapy. I'm burned out owning a business. I need time for my family. And that's when I found the OTA program in my town and went there, had a great experience. And I thought, one day I'll become an OT because I already have my bachelor's and, that's my next progression, not realizing that's really not necessarily how it's supposed to be. It's not supposed to be a progression of one to the other. It can be, but for me, that wasn't my path. And I love the profession. I worked clinically and then eventually started teaching. But my path to OTA, it was challenging making that leap in my mid-30s and trying to determine, is this really the right thing for me? But I felt totally led to the profession, and here I am. And, almost 20 years later.
I relate to that so much. I live in rural Nebraska. Our closest school is definitely our OTA program. That is not far from me. I would also have to travel so far to go to an OT program. I'm also in one of those areas that I mentioned in the intro where OTAs just provide a lot of the treatment that is available in my area. There's such a bedrock of occupational therapy services in rural areas like mine, and just so critical. I think of you as someone, like, I look at your career path, and you have done such interesting things with your OTA degree. You chose not to bridge to OT and to pursue other paths. Can you just tell me about how that has set you up to advance forward in your career? And I guess I'm curious too
Yes.
about, like, you decided not to become an OT and to go these other ways. What was that decision making?
So it's interesting. I think sometimes OTAs feel the pressure from people around them that say, you're smart, you're good at what you do, you should go be an OT. And so I definitely felt that pressure also. But at the same time, there were no pathways for me to do that without sacrificing like too much time away from my family. And I also thought, I really like this. I really enjoy being the OTA. And I found teaching, which is my great passion and I love, which we do in clinical practice also, but to be able to get to teach other occupational therapy assistants was one of the greatest joys of my life, to be able to see them go on and change people's lives. So it gave me entering into academia, just started out as a guest lecturer, and then I was part-time, and then morphed full-time as I was working clinically, and found that education is my preferred practice area and the difference that I can make in my students' lives. And so along the way, yes, there were new opportunities for me to become an OT, but I decided that's not what I wanted to do. I wanted to pursue higher ed, and a clinical OT degree wasn't going to help me do that. And so for me, already having a bachelor's, I decided I wanted to get my master's in healthcare administration. And sometimes it's the low-hanging fruit. We had a university nearby that was offering education in the building I worked. They came and did a special program for a master's because they wanted to support the healthcare system. And where I went to school was part of a larger healthcare system. And so for me, it was a low-hanging fruit of like, this makes sense. I'm balancing family responsibilities, a full-time job, and a master's degree. So I did what made sense for me. And I knew that master's degree would expand my skill set and and really just give me more options and I had in my mind that one day I wanted to be a program director. That was my next step. I'd been a full-time faculty member. I loved that, but I really had a desire to do more and lead in a different way. And then My current college, where I work, and I'm the founding program director, the Rowan-Cabarrus Community College, they were starting a brand new OTA program, and I thought, wow, I'm going to apply for the job. I don't know if I'll get it, but I have a passion for it. I've never done that before. Every job I've had, I've never done before. So it's taking a leap of faith, right? Let's try this out. And that seems to be a kind of a recurring theme in many of the things I've done is I've just said yes to things where I may not have felt like I have all the skills because I haven't done it yet. I don't have the experience, but I have the skills actually. And just understanding that. And so while I was getting my master's and transitioning to Rowan-Cabarrus, they hired me to lead the program. I thought, I get to start a brand new program from scratch, hire my own team, create the curriculum. It's very exciting to me. I do like a good challenge. And along the way, in the middle of all that, my good friend Amber Ward and I, who had worked together, ended up writing a textbook. And, I say like 5 seconds, but it took 5 years, literally from start to finish, to do that. And so that was, to me, one of my greatest gifts to the profession is that writing that textbook and making it a useful tool for faculty and students. And then starting the program was another incredible opportunity for me to really, and I shifted gears from a private, not-for-profit school to a community college. And there's a big difference in the population that attends. At least in my area, that's true. And I know that's even shifting some now, 15 years later. But, the community college is seated in the community. And there's a real opportunity to be absolutely part of changing people's lives and seeing them hopefully, and we'll talk about this later, be able to earn a livable wage and a sustaining wage. And almost all of my students are working. Many of them have children. Many of them have older parents. And so they're struggling through school and hoping to make better lives. And some of them are new right out of high school. We have a really broad range from like 18 to 52 in any of my given classes. So a real cross-cultural mix, very diverse mix of people who live in the community who are going to stay in the community and do the work and serve the community.
I love your story because it so exemplifies OTA, one, as a satisfying job in itself. Like I'm always like, the best part of OT treatment is your time spent with clients, not doing all the other stuff.
Right.
And you get to spend your time doing the best part of OT, doing those treatments, doing those interventions. And then OTA, as your story exemplifies, can just be this jumping off point to all kinds of different careers. Like, I think we get to like blinders on like the next step would be an OT, but that is not true. Like this core skill set, I think sets you up to do so many things, if that's something that people want to do.
One of the important parts that I wanted to share is like volunteer leadership, and I think sometimes folks think that if you're an OTA, you can't be the president of a state association. Not true. I may have been the first. I'm not sure if I was the first or second in North Carolina history to be the president of the association. And again, I'd never done that before. Served on the board for a long time, learned from others who went before me, who mentored me in that. And then, serving at AOTA for 6 years at different levels of the association, and just saying yes to the opportunity and making sure that we are bringing forth the perspective and the voice of OTA. More OTAs need to step up and do that. And don't be afraid of it. It's not this. I think one of the myths I want to debunk here today is that there's this hierarchy between the OT and the OTA. We are partners in what we do, but sometimes OTAs feel or are made to feel from various aspects that there's a hierarchy because there's a degree level difference, but we truly are partners in the work that we do. And that's important to have that mutual trust and respect for the partnership.
Yeah. Oh, yeah. And I want to add to that. I'm like, when I think of almost every volunteer organization, related to therapy, we do not have enough frontline providers in those leadership roles. Like we over-index towards academia who,
Yes,
which they have a great perspective, but it's a limited perspective, and we need more frontline
absolutely.
providers. Like, please, OTAs, we desperately need you in those leadership roles.
Yes, we do. Very much so.
You started alluding to this, but one of the things I wanted to just jump off or jump into was the struggle that we have throughout occupational therapy. One, occupational therapy itself is we often describe as not being as well understood as it could be, both within healthcare and by the general public. And then just as I say that, I can see the compounding problem where then an OTA is both struggling with like the general misunderstanding of occupational therapy and then their specific role as an occupational therapy professional. What do you wish more people understood about the OTA role?
Thank you for that question, Sarah. I want people to understand that, first of all, the education is rigorous. If you've not been through it, which if you aren't an OTA, you wouldn't understand this, but our education is rigorous. We have many students come to us that already have a bachelor's in something else, and they come to our program and they're like, wow, this is way harder than my bachelor's degree because it's healthcare, right? So we have a high standard, and it's not an easy degree at all. So I want everybody to understand that, first of all. And then we have many of the same standards that we have to meet from ACOTA in providing the education to the students, and that we are setting a high bar for practitioners, because OTAs really can do everything except the eval. Like that's, we have very similar, of course, we're following our practice acts in our states, and we have supervision guidelines that provide support. But the OTA, I think, is misunderstood that we can do assessments. We have a whole course in assessments in our curriculum. So OTAs can do assessments. And I think in the profession, because an occupational therapist can graduate and work and never have an interaction with an OTA like you did, they may not have an OTA in their workplace. They simply may not understand what an OTA can do, and they may not understand the supervision piece of working collaboratively with an OTA. So I think there's maybe a lack of understanding also, or lack of experience. So that's one piece of it. And, doing the assessments, we can work in pretty much any setting, as long as you're following the State Practice Act, right? And the states do differ in some of those things, but OTAs are really, truly the intervention specialists. And so many occupational therapists rely on the OTAs to be the experts at the intervention. So they can focus on things that only they can do. So I feel like if we can get more OTAs, get the role more understood, have more openings for OTAs, use us more in all of the places where occupational therapy is happening, then we can save money, right? Because that's always, how can we save money? How can we be more efficient? You can hire an OTA for less than you can hire an occupational therapist. And so let us partner together. Let us do more. Let us do all that we can to help assist. We work more with clients one-on-one, and we have that incredible perspective. We build that relationship with our clients like OTs do as well. But I think we have an opportunity here to bridge the gap. And financially, it makes sense to hire OTAs and OTs.
Mm-hmm. I'll call myself out as someone who was not practicing ideally, where I feel like as the OT, I did always do the assessment and I wasn't leveraging OTA to help with that. And I'm like, one, that was me not working ideally. That was also a different time and place 10 years ago when you could get away with not doing frequent retests. And now in like this, where our notes are under such scrutiny, I think it's so important to be documenting that test retest probably at almost every session, especially at outpatient if it's been a week since you've seen that patient. we absolutely have to be partnering with our OTAs in that way. And that was a bygone era when we weren't doing that.
That's a great point. And we have to have those outcomes, and OTAs can help with that. Another area that OTAs really can shine is in clinical management and leadership. There's nothing that says an OTA can't be the clinical lead. I have a former student who owns a business in the area, and all of her leaders in her business in OT, PT, and speech are at the assistant level. And they're leading groups of OTs and OTAs and the assistants and the full practitioners as leaders in that space. And she is purposefully lifting up and creating space for OTAs and PTAs to be able to lead, still practice clinically, but also shift that hat. And I think that is innovative and honoring of the roles, and gives pathways for OTAs to be able to rise up in leadership positions, because it's not about supervision, it's about management. And I think we sometimes get those concepts confused in practice.
Mm-hmm. That dynamic of I'm just thinking through the logistics of like many of our OTAs come to OTA as a second career. That was the OTA I was working with.
Mm-hmm.
I was a new grad, and I was like, the OTA I worked with, she was totally our manager. Like, she was so organized. She was a second career. She was 10 years older than me. Yeah, that's already a dynamic that exists, and I would love to see OTAs step into that more fully, because we so need that skill set. Another thing I wanted to touch on more explicitly was just the importance of OTAs in around the country. They see people in underserved areas they provide the most treatment minutes, like in rural areas. That feels really important to understand as we head into some of these next hot topics about like decreasing reimbursement and decreasing enrollment, and what population areas are going to be disproportionately affected by that. Do you have anything just to add to that thought, that just feels important to be like seeing people in rural areas and underserved areas?
I think it's really about numbers. You can pay an OTA less than you can pay an OT. And so we can be encouraged to provide those services in those rural areas. And also, if we're being educated in the community where we are living and serving, that's another reason that we can have more OTAs in those areas, because they're living there. They're invested in the community. This is their community that they live in, and they're much less likely to pick up roots and move to another state than occupational therapists are, because they might be going to school in a whole different state, and may be transitioning somewhere else. So I think those rural communities are at a greater risk of being impacted by social determinants of health. And this is really critical to continue to use OTAs, because we do impact occupational engagement in every aspect that we work. And I think with PDPM, we saw a decrease in the use of OTAs in our SNFs. I think that's starting to return back, but we have some new challenges ahead as well. And I think it takes management understanding the value really that the whole profession brings, but especially the OTA, that we are skilled providers, that we can be the partner with the occupational therapist. We can't do it all, which is why sometimes we aren't hired, frankly, because there's sometimes a narrative that if I'm going to hire one person, well, I have to hire the occupational therapist. But if I'm going to hire two, I could hire an occupational therapist, an occupational therapy assistant, and maybe PRN OTA. And then we can see more patients, and we can make sure the needs of our clients and patients are being met.
We had PDPM, the change to our skilled nursing facility reimbursement. I think was it in 2020 where we also had the 15% payment reduction to OTAs and PT physical therapy assistants. Can you tell me just like more of what you know about that and the impact that you've seen? I just say it and it makes me just really frustrated. I do not like this. Can you
Yeah.
just talk to me about it a little bit?
Sure. And honestly, this is not my area of expertise. I feel like there are other people who could talk much more eloquently about it. But
Mhm.
what I can share with you from what I've heard, being, at the board table at AOTA, but also an active engaged member of my state and national association, and what I'm hearing from my advisory committee and my graduates, that impact. Not only is it a cut in the reimbursement rates, it drove fear in the hearts of business owners and occupational therapy assistants and physical therapist assistants, because if the company's being reimbursed for less, then you're going to cut my pay, right? It's all about the money. It has to balance. And so if they're getting paid less to see clients, then there's might be pay reductions. And you challenge that with increased cost of living, increased cost of education, everything going up. It makes it really challenging. This is a big issue that we're dealing with. And also the administrative burden that businesses are having to do by adding modifiers. So even, on top of the cut, now there's extra work on the business end of it when you're using a PTA or an OTA to be able to do the billing. And billing is hard, especially for the small businesses who are trying to juggle it all and really provide services in their community. We're facing tough times.
Yes. I'm going to put out charts related to this at the end of the week, just so we can see this data clearly. But my general understanding is like the OTA degree has historically been one of the higher reimbursed, or an associate degree where you could enjoy a higher salary on average. And then this 15% reduction, like correlating with that, we started to see just like a stagnation in
Yes.
that salary growth. So it's still like middle of the road to slightly higher among the potential OTA or among the potential associate degrees you could get. But we're very concerned about this trajectory. And for me, it's one, about the health of the profession, but two, we just know people are not getting the therapy minutes that they need. We just had an episode on skilled nursing facilities. There's this push to go down to like 20-minute sessions each day, and that does not match the science that we know of
Nope.
neuroplasticity.
Absolutely.
This is something we have to be so loud about to CMS. These payment models are not allowing us to provide. One, they're not allowing us to provide evidence-based practice, and two, they're disproportionately hurting underserved areas and rural
Absolutely.
areas. I think we have to be so loud about this. I'm hopeful we can even change it. Do you think we can change this trajectory? Like, I think we have such a strong argument here. Like, this is hurting older adults. Yeah. It's hurting people after a huge health event.
I think if we get our voices loud enough to the right people over time, like I think it's a big challenge, but it is so worth fighting. Like advocacy is always the right answer. Like we always need to be advocating and doing. Like we have to show up and show our value. Because of the reduced reimbursement, that does mean lower salaries for OTAs. And it means that they're not getting paid what they're worth. And, we tell them in school, you bring value to what you do. And they do. And same thing with occupational therapists. But we're in this time of trying to balance everything. And we're at a critical point, Sarah. And I think you're right. We need to be loud, because loud is often what gets paid attention to. And there are many other loud voices and forces that we all have to navigate through. And I mean, political forces are very difficult. So I think legislating and working advocacy at the Capitol level, at your state is critical, but it's so hard to get anything done there. So I think going to CMS is probably our best way to make movement forward. But we need more than just you and I. Like, we need everybody on board. We need our practitioners to understand what's at stake. They need to understand the crisis, the sense of urgency that this has, and we all need to gather in. Like, we need to collectively be the voice to make change. That lower pay is leading to burnout. People are having a hard time, navigating student loans or feeding their family, raising families. When it comes down to it, people have to eat. They have to have a home to live in and a car to drive and take care of their family. And with the cuts, it makes it hard. And again, that's for our practitioners. And then if they can't provide the services, our society is not having the services that we know we bring. Like, OT is so powerful. We need to remember that, and not just take for granted the power that we bring in occupational therapy.
Yeah, we definitely need every voice on this issue. This is something I historically have not done. Before this year, had never written a letter to CMS. I hadn't really paid attention. I was like, oh, I'm paying my AOTA dues. That's enough. No, we are in a reality where we really need all practitioners to be looking at these problems clear-eyed and to be using our individual voices to reach out to CMS and maybe to our legislators if it's a legislative thing. We're talking about hard things. I'm just going to bring up another hard thing, which is decreasing enrollment in OTA programs. I've been just talking on social media about just overall, we're seeing less applications to OT programs, but enrollment has kind of stayed more steady. OTA, we have just seen a drop in enrollment over the past couple of years. It actually started in 2015, which is interesting to me because that predates the 15% reimbursement cut. This is such an important profession. It's a good profession. How do you understand that drop in enrollment?
I think it's really complex. I think there are some really negative voices. I think we haven't talked about social media yet, which could be used for the good. And it can be used as a place for practitioners who are burned out to try to find some support. And so you see groups popping up where there's a lot of negativity about the profession because people need to feel seen and heard, and they're hurting and they're burned out and they're not finding the resources and the connection point to help them prevent burnout or get beyond that burnout. And people are leaving the profession. And then prospective students, if you're going into a field, you might do a little research. You might pop on social media and see what's happening. And there was fear behind the OTA degree going away. Back in 2017, there was a mandate from AOTA to shift to doctorate only and baccalaureate only for OT and OTA degrees. And so that was a while ago, but there's some lingering effects of that in some places that, is this degree going to go away? No, it's not. I don't believe it is. We are too important and too powerful, and you'd have too big of a gap if the associate's degree went away. So that plus, I think people are, after COVID, I think that played a part as well. We definitely saw a drop in really the whole profession after COVID. People just saying, I'm not going to get involved in healthcare, where healthcare prior had always been a stable job where you can make good money. I think it still has the possibility for that, but there's so many factors. I think there's a lack of understanding of the role of the OTA. I think there's a push towards 4-year or higher is the best thing. Why get an associate's degree? It's maybe not as fulfilling or isn't the experience that some high school students are looking for. I think we have opportunities to talk with guidance counselors to help them understand the full capacity of the return on investment of an associate's degree. My program at Rowan-Cabarrus is less than $10,000. And that's a degree that you can come out making in our region about $60,000 median. That's a really good return on your investment.
Mm-hmm.
But it's so complex. Less high school graduates. People want to also, I think they want to make more money. So I think we see a shift towards graduate degrees, even though it's going to cost them more. They're looking maybe at the long run, and parents are talking to students and saying, you really should go for the long haul and you've got your whole life ahead of you. Why not get, the higher level degree? And that's great because we absolutely need occupational therapists. So I'm not saying don't do that, but we see this opportunity here where some programs are closing. There was a little blip a few years ago when we tanked in numbers of programs, but we're back up to that 2015 level of numbers of programs. There are bachelor's degree programs starting in occupational therapy assistant, which is, there's a lot of mixed feelings about that. We're not here to talk about that today, but that's another opportunity. But most schools that offer that have to be a university. Community colleges in most states can't offer a baccalaureate degree. So we see these trends shifting. What else could you do to go make $60,000 a year? You could go work some other job. You could go do something else that's not as hard as being a healthcare practitioner. I think we're in trouble, but we're also at a point where it's a great cross-section of really considering that return on investment, staying in your local community, going to a college for occupational therapy assistant where you can, for not a lot of money, right, have this degree. And yet it's still sometimes really hard for our students. So I'm a big proponent of scholarships and grants and everything else that we can help support our students to get them through the program. But Sarah, it's really complex. I've asked a lot of people this question, why is there decreasing in enrollment? And, I get all different kinds of answers. OTAs are not well understood, the pay differential. We could just talk for a long time. And yet there's good work to be done. And yet there are opportunities within OTA programs to have more students. I think we're at a 55 or 57% fill rate across the country when you look at the number of seats that are available for OTA programs to the number of students who are coming. Another factor is, there's more awareness of other professions. So, for instance, one of our community colleges in North Carolina they added a lot of other healthcare degrees. And so now there are more options for students to go different pathways, and OTA may not be their first choice. It may be, something else. So same number of students available, more degree options. That can also decrease the number of enrollment.
I get a lot of people that message me on the side or unofficially to be like, do you really think these are good? OT and OTA are good degree paths for people. And I think about all these hard things that you and I are talking about, and I am still yes, it is a fulfilling career. And in 2020, if I'm looking at what career I want to do, probably the biggest thing in my head is COVID. A frontline healthcare profession. I am just am bringing lots of feelings to that. But now in 2025, if I'm a student, I'm looking and I'm saying, which of these jobs are going to be replaced by AI? To me, it's a whole different question set. And as some of these easier associate degrees, you're that's a red flag for me, actually, because that workforce going to be replaced more by AI. And the OT and OTA degree that is so enjoyable of showing up and working, doing that one-on work with clients, that will not be replaced by a machine or a robot anytime soon. So I think I'm saying there have been some hard wins in our face, but just as quickly there could be wins in our back, and we need to be ready to pivot and position our profession as catching those Do you agree with that?
I absolutely agree with that, Sarah. This is our opportunity. Yes, there's a lot of fear over AI. I've certainly read a lot, been to a lot of training sessions. We're using AI in our program. And I think our opportunity for AI in occupational therapy is multifaceted. I think it can help us collect data. I think it can help us be more efficient in our jobs. We are the only ones that can show up for our patients. AI cannot show up for our patients, but AI can help us brainstorm ideas. It can help us make our documentation more worthy of criticism, right? And the reimbursement challenges. I think AI is a great tool for us to use where we can really put our focus on our patients and being present with our patients. So I think it's a great time. And I'm so glad that you brought that up so that we can embrace that and keep moving forward. I think it's kind of almost a saving grace in some ways to be able to have this new tool as we're trying to figure out all the other things that go with it, like the ethical use, the compliance issues, all those things that are being worked on. But we are embracing it, and I think it is an opportunity for us to be more effective.
I haven't even told you this. I'm making an AI chat like within OT potential. And I do keep thinking of OTAs because I'm like, the parts that have been a grind, like historically, I think like that documentation part,
Yes.
just like surfacing research and ideas, like that's all going to, these AI tools are going to be awesome. And I just think the career is going to be really appealing in a way that even 5 years ago, the parts that were a drag, these AI tools are going to help us and we can really focus on just the great parts of the work.
And I think that can be part of the messaging about occupational therapy, harnessing the power of AI and so that we can spend our time with our clients. And I really like the way you said it, but we are in a different place. We really are. And I can't help but wonder, like, where are we going to be in 5 years? Looking back on today's conversation, where will we be in 5 years with this?
We've talked about how OTAs are not as well understood, the headwinds. What's a vision for how we can just more fully use this full scope of practice? We've touched on that a little bit, but I just want to like say it explicitly for people and to just paint that vision. What do you see there?
I see, I would challenge every OTA who is listening to find your area of passion and dig deep. Find what really ignites you, find what you love and dig deep into that. You don't have to be all things to all people. Find your thing. You can create a unique program for the clients that you serve. You can serve in the community. You can build on your skill sets and try additional rollout like manager or business owner or CEU provider. You can be a common role would be director of rehab that we see sometimes OTAs have that role as well. I think we could earn along your career path, the skills that you learn as an OTA are absolutely invaluable. And there are opportunities, outside of direct patient care when it arises, like education. I try to bring in as many other OTAs as my adjuncts as possible, guest lecturers, or come in and help with a competency, bring them in and do adjunct roles and train them in the role of being an adjunct. And they realize I can see that in them, but they may not see that in themselves. So sometimes it takes us partnering in collaboration and in community to build each other up and say, hey, have you thought about doing XYZ? Because I see that skill set in you. And I think you'd be fabulous at it. And let me mentor you, or let's connect you with someone who can do that. We can work in the nonprofit sector. We can own businesses. I know the nonprofit may not pay as much, right? And sometimes it comes down to salary that you need, but there are opportunities. And I think it's important to never say never, to embrace opportunities. That's been a theme of my own personal career and my own growth is to just look for opportunities and say yes to things and have the courage to do them, even if there's always a little fear there because you can never really have courage without fear. That's what makes it courage. And being bold and strong and moving forward and embracing opportunities. So I think there are opportunities for OTAs. What I don't want is for an OTA to think, well, I'm pigeonholed in this job and I see no opportunity for growth. That makes me really, really sad. And I hear OTAs say that. And so it might be that you need to shift to a different setting, perhaps, or try on a different role, or, get trained in XYZ, like, I default to business because I was a business owner at one point in time, but there are opportunities, that could be side gigs or, learning more about business. So making yourself as an OTA, like we're good at observing and finding where we could fill a niche, like where's the problem and how can I fill that? And like changing that mentality from we should to we can and actually doing it.
I love that. We've had really interesting questions come in. I'm trying to think of how to package them the best into a couple minutes. Someone asked about how to educate OTs more on what OTAs can do. I'd love to hear you. That feels important. I'd love to hear you speak to that. Just from my own OTA, being in that OTA partnership, like I just loved that collaboration and I loved broadening my lens, like sometimes getting pushback against what I was doing. Like I love that. And I hope more people can find that kind of partnership. But what's your advice to that question?
Oh, I have so many thoughts on that question, Sarah. I think, it starts in the classroom. It starts with OT programs, understanding, and not just the program, but like it comes from leadership, like program directors of OT programs, faculty. It comes from them truly understanding. And not just like because ACOTA mandates that they teach about OTAs and how to supervise, be a supervisor in the true sense of clinical supervision. It takes a desire to want to know, like a desire to walk in another person's shoes, to really understand the role of the OTA, and then to fully to understand it and embrace it, and then create those opportunities with OTA programs in the area. And I know many OT programs are doing that. Oftentimes we see OTA programs reaching out to the OT programs because we have to. We have no choice. We can't go practice as an OTA with my full license without an OT supervisor. So we have to train students from the very beginning role delineation. So it's natural for the OTA, but maybe not as natural for the OT. I think OTAs need to be in more leadership positions at state and national levels, but also in institutions. We need to not be afraid to lead. And, one of the beautiful things about really OT practitioners in general is we don't really enjoy conflict. When you look at the research, we tend to be more, less assertive and, we don't want to make waves or ruffle things, but we have to know our value and be able to speak to that. So, education is number one. But then how do you, my problem has always been, how do I get to the level of the occupational therapist who's been practicing for 20, 25 years, who doesn't really understand the role of the OTA? How am I going to get to that person? How am I going to change their mind? Because maybe they had a negative experience with an OTA. I would say that was one person. Like we all have negative experiences with people, and it's not because they were an OTA, it's because it was a person. And, I think it goes back to emotional intelligence and building our emotional intelligence and giving grace and seeking to understand. And then making pathways. We need people who are going to fight for and open, create bridges and open pathways for OTA roles, but then also mentorship. If it's a new emerging practice area, an OTA might be great in that there might need to be mentorship along the way. Or going into acute care. OTAs are less employed in acute care than long-term care for lots of reasons, but it's not that we can't be in acute care. We can. But the managers have to understand how OTAs are used as well. And so I think it's going to take all of us really understanding and valuing the OTA OT partnership. And I think, we use the word collaboration a lot. I think it's really deeper than collaboration. It's a partnership of two coming together. And you spoke so beautifully of that, of using the skills of the honoring and using the skills of the OTA along with your OT skills and just who you are as a person and how you think and how and so it's really mutual respect and understanding, getting to know one another on a very basic level, and then working together and honoring that. I hope I answer your question, but I could probably go on longer.
Oh, I'm always like, the problems that we're tackling as OT professionals are so complex. You really need those different perspectives, both from talking about the degree level, but also just personality types. Like you're combining two different personality types and their strengths of both. And that was my big joy in that partnership, was just working with a different personality type that brought what I lack.
But you valued that, right? So that's the piece, that's the emotional intelligence piece, that you valued what that person brought.
I keep thinking emotional intelligence for OTAs, though. I'm like, these are the people that work with patients all day. Like, you are building this emotional intelligence skill set that I really think is the skill set of the future. Like, I think that if you can emerge as someone with high emotional intelligence, you are going to stand out on every team in every.
Agree.
There's a lot of headwinds to developing our emotional intelligence, so that this is a skill set or a career where you really get to hone that. I think that's going to make people stand out a lot. We're getting close, but I want to squeeze this in. Someone asked about advanced certifications, and sometimes following a passion might be digging into driver's rehab, or I do a OTA certification post each year, and I'm always surprised. There's just a lot of advanced certifications available to OTAs. Do you just know any personal stories of someone who's dug deep into driving or swimming or wound management? And I can imagine the pathway of being like, I'm going to do this eval, and then I'm going to have the OTA really take it, because this is her specialization more than mine.
I think one of the challenges that we have in an OTA getting the specializations is that the OT also needs to have competency in whatever we have competency, or we can't do the intervention. So it's like both you have to partner together in those specialty areas. But I certainly know many OTAs have do advanced neuro-IFRA, or they are, certified brain injury specialists, or they dig deep into the pediatric world of SOS feeding, or all these different things. Or even lymphedema. I know 2 or 3 OTAs who love lymphedema work and got their full-on certification in lymphedema, but they can't practice unless there's an OT who has lymphedema certification also. So it's a little constraining, some of those things, based upon where you're working. But I would say dig deep, explore. And I do love that you provide that update every year. We use it with our students. There are so many different levels of certifications. I think we also have to be careful, and that's a whole nother conversation. What's the certification? What's the certificate? What's the value that it brings? What's the meaning of what I'm getting, and understanding what you're getting? ATP is another thing that an OTA can do. Seating mobility specialists, there's all these different things. And I think it really depends upon your workplace, the needs, your passions. Again, it comes down to cost. And maybe employers might have reimbursement options, or if it's something you're really passionate about, you save up for it and you do it. And I think that is an opportunity. But the challenge also with that, because there's always 2 sides to everything, is, am I going to be paid more? Right. And so again, it comes down to the pay. Maybe not, but maybe go open your own business and do this thing that you love.
I'm excited because I see this Hot Topics in OTA as an annual series. We've touched on a lot today. I know there's more to keep talking about in years to come. As we're coming to the end of the time, we've talked about hard things today. We've talked about some of the headwinds we're facing, but also the forces that can really drive this profession forward. Can you just close us on like a vision of where you see this profession going, like in the hopeful sense of like, what are the possibilities out there for us to capture? Yeah, where do you see the OTA degree going?
I think the degree is, I would hope, is here to stay. Like I'm banking on that. We need this degree. We are OTA programs historically, and it's still true today, attract the most diverse set of students when we're looking at demographics of race and ethnicity. We are the most diverse in the workforce. Mm-hmm. We need us. We need OTAs to be able to represent our communities. So I think there's a strong there's a need for us. We have to keep fighting the reimbursement battle. We have to keep fighting CMS. We need to advocate together, but we also all need, and this is really every practitioner, but if I can really especially speak to the OTAs out there, know your value of what you bring to each and every patient. Like you are a connection point for that patient or that student or that client, whatever setting you're in. We all use different language, right? You are that person's connection point, and bring your full self to that connection and do occupational therapy the way you know it can be done. We are going to see by doing, we're going to see a change. We're going to see better outcomes. You are going to be happier in your role as an OTA. We need to address burnout also, and that comes with reimbursement. But I would like to see the role of the OTA more well understood by the entire profession and valued by the entire profession so that we can keep moving forward together in this partnership where both the OTA and the OT work in true partnership to deliver every aspect of care. We should be in every setting together. And I think we can be.
Yeah, that was so beautifully said, Amy. That just so grounds us in like, this is such important work. It's such personal work. We need it going forward, and we need that advocacy. Thank you so much for talking about all this today. I know we tackled big things. I just want to wrap us by saying thank you so much, Amy, for one, being an example of what that career advancement can look like, what it looks like to take on leadership roles, and two, just being here with us today to share what you've been learning.
Thank you, Sarah, for the opportunity. I feel like we've been like around the world a couple of times today. So really great conversation. And thank you for this being the first of an annual series highlighting hot topics for OTAs. Thank you.
Thank you. Thank you for joining us on the OT Potential Podcast. To earn 1 hour of AOTA-approved continuing education for your time today, you will need to sign in or sign up at otpotential.com. Once you're in the OT Potential Club, you will find a 5-question post-course quiz connected to this episode. When you pass the quiz with a score of 75% or higher, you will be able to download a PDF certificate that certifies your completion of this course. Okay, I want to thank you for joining us today, and we'll see you next time.